It's been a year since I've seen you last.
Yes.
So you're just here for your annual exam?
Absolutely.
Okay. So any updates in your family history?
No, not in my family history.
Okay. And I think last time you were here, you were having some headaches.
Yes.
Has that gone away?
Yes, headaches have gone away,
Okay,
and now
great.
it's a new issue.
Ooh, okay. Let me know.
Yeah, I've been using a shampoo and conditioner, but it's a new shampoo conditioner, but lately it's been like making my head dry, itchy, and I'm like flaking a lot, so I'm getting a lot of dandruff.
Okay.
I tried changing it out, but I'm still having it. It's continuous.
Okay. Have you used shampoos that are targeted towards dandruff?
Yeah, I've used like that Walgreens big brand. It's like that blue and white bottle.
Head and Shoulders.
Yeah,
Okay.
which has helped, but it's still consistent. So I don't know what else it could be.
Okay. Have you had any itching as well with
Yes, yeah.
it? Okay. Have you noticed redness in the scalp?
From what I see, I haven't been able to like look clearly. But a lot of the itchiness is like back this way.
I can go ahead and take a look at that for you and see if we can apply some treatment for today and perhaps get you a prescription shampoo, conditioner.
Awesome.
I think that might be necessary. Any changes to your diet and exercise?
No.
Okay. Are you still getting aerobic exercise each week?
Yeah, I haven't been doing it as much as I had been, and now that it's winter,
Sure, yeah.
just getting out of the house and then getting in that water is just, it's a lot,
yeah.
but yeah.
Okay, all right. Well, if you don't have any other issues, I'm just going to take your vitals first, and then I'll go on to examining your scalp, and we'll do a whole head to toe exam.
Okay, thank you.
Great. So I'm going to start by listening to your heart and your lungs.
Okay.
Just breathe normally. Okay, heart sounds normal. I'm going to listen on the bell side for murmurs. Okay. Murmurs present. I'm going to take your blood pressure. Can I use this arm?
Yes.
Okay. Okay, that's really good. That's 106/80. Perfect. I'm going to slide this off. Okay, I'm going to take your temperature. Perfect. 97.8. oxygenation. Go ahead and rest your hand here. Keep your legs uncrossed. Okay. Your heart rate is a little high. It's 111 beats per minute. Were you late getting here?
No,
You want to rush?
I'm always running late.
Okay.
And I stress about it.
Sure.
It's really a problem.
Okay, well, don't stress. It's okay. You're here. You're able to be seen. So just take a deep breath. Oxygenation is great. Did you have coffee this morning?
I did.
Okay, that probably contributed to some of it. I'm just going to make a little bookmark here. Keep our eyes on it. Do you ever have heart palpitations or heart racing?
Sometimes heart racing, and I just try to like do breathing exercises to calm down.
Sure, absolutely.
Yeah.
Does it happen pretty consistently at certain times of the day?
It's very random.
Okay.
Just once every so often, usually when I'm finding myself like overwhelmed, overthinking, or stressed.
Okay, so probably anxiety based.
Yeah.
I didn't hear any heart murmurs or anything irregular with your heart. So I think that it is probably due to that.
Yeah.
But we'll keep tabs on it for sure. Okay. All right. I'm going to take a look at your eyes and ears.
Yeah.
First, though, I am going to just palpate your face and feel your lymph nodes.
Okay.
Palpable. Try to lift your eyebrows for me. Good. Now lift them. Try to lower them. Good. Now resist my push and turn your face to your left. Good. To your right. Good. Now try to look up at the ceiling for me. Good. Chin to your chest. Excellent. Puff up your cheeks as wide as you can go. All right. Okay, go ahead and look straight ahead for me. I'm going to take a look at your eye. Pupil is round and reactive to light. I don't see any signs of infection or dryness, no jaundice. Go ahead and blink once for me. Okay, and just with your eyeballs, look up, look down, to your left, to your right. Very good. Okay, look straight ahead. Same here, no issues. Okay, look up, look down, to your left, to your right. Blink once for me. Good. Okay. Going to open your ears. Tympanic membrane is a normal pearl gray in color. Don't see any scratching or scarring. I do see a lot of wax buildup, so if we have time, I'd like to clean that out for you. Okay. No redness here. Okay. Same thing here. Nice gray tympanic membrane. No issues present, just some wax buildup. Okay. Excellent. So what I'd like you to do is hold this chart at arm's length for me. Okay, can you read this line?
D H J B S
Can you read it backwards?
S B J H D
Great. What about that second to last row?
C F D H J
This top letter here.
E
What color is this?
red
What color is this?
green
You see that towel sitting on the chair? What color is that?
purple
Which circle is larger, number 9 or number 8?
number 9
Okay, number 7 or number 2?
number 7
Number 3 or number 2?
number 3
Alright, so I'm going to just test your peripheral vision.
Okay.
I'm going to bring my fingers into your field of vision. Pick a point straight ahead to focus on. And when you sense my fingers entering your field of vision, say now.
now 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 now
Okay, very good. Now look directly at me. Which fingers are closer to you? My left.
left
Okay. What about now?
right
Great. Which fingers are moving?
left right both left right both
Good. Okay. Now let me know when my fingers leave your field of vision.
now 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 now
Excellent. Okay. I want you to focus this light right here and follow it just with your eyeballs. Don't follow my fingers, follow the light. Nice, okay. So your eyes seem very healthy. Any issues seeing?
no
Okay. Okay, I'm going to test your hearing now. So go ahead and close your eyes. Let me know which ear you hear the rustling sound in, your left or your right ear.
left right right both
Good. Now let me know if the sound of these gloves are coming closer or further away from you. Okay, so here's option 1,
closer
2,
farther
okay,
farther closer
very good. I'm going to whisper a few words in your ear. Repeat what you hear after me. Left,
left
right,
right
center,
center
Christmas,
Christmas
cabinet,
cabinet
volleyball.
volleyball
Very good. So I have this tuning fork. I'm going to be placing it on different areas of the face.
okay
Close your eyes. You're going to feel and hear the sensation. Let me know when it stops, and if it stops at different times, let me know that too.
okay stopped 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 stopped
Let me know which option is louder.
okay
1 or 2. This is 1. This is 2.
2
This is 1. This is 2.
2
Any issues with your hearing that you've noticed?
No.
Okay. We're going to move on to your smell and taste just to get the cranial nerve test out of the way.
Okay.
And then I'll look at your scalp.
Okay.
We're going to do a taste test first. We have a few options for you to taste. These are called testing strips. And what you're going to do is close your eyes, open your mouth. I'll place it in your mouth, close it, taste it, and then I'll take it out.
Yeah.
Okay? Here's option 1. Close and open. What did that taste like to you?
Like chocolate.
Chocolate? That was perfect. That was chocolate. Okay, second option, open, close, open. What did that taste like to you?
Ginger.
Mm-hmm. Open, close, open. What did that taste like?
Mint.
So that was avocado ranch.
I could see that now.
So that's the only one you got wrong. But since you got the other two right, we're gonna go ahead and say your taste is pretty good. But since you did get it wrong, I'm gonna take a look inside your mouth just to make sure that things look good. Okay, go ahead and open for me. Alright, tonsils look very healthy. Very good. I'm seeing no issues here. I'm going to take a sample, just a cheek swab, just to make sure things are good. Okay, go ahead and open. Thank you. Okay, we'll send that to the lab.
Okay.
Next, we're going to do a smelling test.
Yeah.
Okay. Go ahead and inhale. What does that smell like?
Like lemon.
Okay, that was grapefruit, but very close. Okay. Inhale. What does that smell like to you?
Very good. Yeah.
You're right, that was very good. Do you have
Smell it
any
again.
other descriptors for me?
Like cinnamon?
Yes.
Yeah.
Go ahead and inhale.
Vanilla?
Yes, perfect. Right. So I'm going to begin the scalp exam. Go ahead, lay down, put your head here, face facing this way, and relax, and I'll go ahead and see what I can do.
Awesome. Thank you.
Okay. I'm gonna go ahead and take off your tie. Seeing just some patches of oil at the top of the scalp. So I'm gonna just take a tissue and remove that real quick, just to help me better visualize the area. definitely some oiliness originating from the scalp, going down to the hair follicles. Just get rid of that top layer. Okay. I'm going to take a sample. Already seeing a little bit of redness. Looking through the light, I am seeing some of the flaking. Definitely redness here. Okay. Going to apply a little bit of serum just to calm down the area of irritation. It's going to feel like a cool sensation. This has collagen and hyaluronic acid. I'm just brushing it in. Okay. Just be taking some measurements here of just some red patches, angioma. This one right here, it just looks like a temporary blemish. I'm gonna measure just to make sure it's symmetric. It's 1/2 millimeter by 1/2 millimeter. Let's see if there are any other bumps here. This little brown spot looks like a birthmark. Okay. That is exactly 3/4 of a millimeter by 3/4, so it is symmetric. Okay. I'm gonna see if it's flush with the skin. Yes, it is. I don't see it raised. Is the scalp pretty much itching all over? Or?
It's mostly in the back top area, right?
Oh, okay.
Like right in here.
I'm seeing an angioma here. It doesn't even look to be a millimeter, but I'm going to just, it's about 1/10 of a millimeter by 1/10, completely harmless. Yeah, I'm seeing the flaking really present here. A lot of redness. Looks like you've been scratching with your fingernails.
Yes.
Okay. It's hard not to, but after I apply a couple treatments, I'm going to ask you to not do that.
Okay.
Okay. This is just a giant dark red patch. It's about 1 inch, it's about 3 millimeters by 3. And right here near the top. Okay, just gonna measure that. It's like a tiny little mole. 1/2 centimeter, 1/2 centimeter. Let me see if it's raised. Well, slightly raised, but it's symmetric and normal in color. Okay. Not seeing signs of swelling of the head, so that's good. Go write that down. First one that I applied earlier. Okay. Going to just take a sample of the area because I'm suspecting an infection here that wasn't present in the initial area that we took our first sample from. Alright, so I'm going to apply some pressure point therapy, just the hairline. Now that you have some treatment on the scalp, I think it's really going to help your skin to absorb it, as well as just help with circulation and blood flow. Good. Just going to apply some foaming solution just at the top of the scalp. Okay. I know this may be difficult for you, but I just want to perform a sensory test to see where you're at in terms of numbness. So this is going to be a soft sensation, and this will be sharp. Do you feel the difference? Okay, go ahead and say sharp or soft.
Sharp. Soft. Soft. Sharp. 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 Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft.
Okay. So, pretty pleased with what I found. We're going to wait for the test to come back from the lab, but for now I'm going to move on to your legs and feet. Okay, so you mind if I take off your socks?
Yeah.
Okay. Sorry. Your ankles seem healthy. Don't see any external swelling. I'm going to do some percussions just to make sure. Okay. Slight deviation, I'm not too worried about it. I'm going to do a propensity response test. Okay. Very good. Facing a vibration on the top of your feet. Let me know when the sensation stops, okay?
Okay. Stop. Stop. Stopped. Stopped. Stop. Stopped.
Good. One more.
Stopped.
Good. Okay, and lastly, we're just going to do a pressure point test on the feet. So this is 2 pressure points and this is 1. Do you feel the difference?
Yeah.
Okay, go ahead and say 1 or 2.
1, 2. 1. 1. 2. 1. 2, 2, 1, 2, 2, 1, 1, 2, 1, 1, 2, 1, 1, 1.
So that concludes our exam. I'm going to send you home with all of the treatments that I applied to your scalp today,
Okay.
along with some prescription dandruff shampoo. We're going to give that about a week until we wait for the lab results to come back. Then I'll give you a call and we're going to reassess, see where we're at, and go from there, okay?
Okay.
Otherwise, you are very, very healthy. No issues. Keep working on the anxiety techniques and maybe cut down on the caffeine a little bit, but your heart did sound strong to me, okay?
Okay. Thank you.
All right. See you again soon. All right, KCC, so I'm going to start just by taking your vitals before we move on to the scalp and skin check, because I know you mentioned having some irritation there.
Yes.
Is there anything else you'd like to address today?
No, I don't think so, other than my elbow, it locks up sometimes and has a little sharp pain, but that's it.
Is that the right or left elbow?
My left.
Okay. And just some joint pain and locking when you move it?
Yeah.
Okay. And on a scale of 1 to 10, how bad is it right now?
I'd say about a 4.
Okay.
Yeah.
Have you taken anything for that pain?
Ibuprofen.
Okay. And does it work?
Yes.
Okay. That's good. Well, I'll give it a look for sure.
Okay, thank you.
Okay. Okay, just start by breathing normally. Okay, sounds feel normal so far. No murmurs. No irregular palpitations. I'm going to check on the bell side. Okay, I can hear S1 and S2. No S3. Just keep breathing normally. Okay, your heart rate sounds normal. I'll listen over here. Okay. I'm gonna listen to your sides now. Let's take a deep breath for me. 2, 3, and out. 2, 3. Very good. Okay, one more. Relax. Good. I'm going to do the other side. In, 2, 3, and out. 2, 3. Okay. Okay, that sounds good. going to take your oxygenation. Just give me your index finger here. Okay, and just rest that right there. I'm gonna take your temperature. Okay, 97.9. Very good. Okay, let me go ahead and read this. Heart rate is 74 beats per minute, which is excellent. And oxygenation is 98% at room air. Good. Excellent. Okay. Go ahead and get your arm perfect. You can rest it right there. Okay. That is 110/78, which is very good. Okay, I'm just going to slide this up. I'm going to start just by inspecting the skin visually. Okay. Very well perfused. Your pores look healthy. And your skin has good moisture. Okay, I don't see any scarring. Slightly red here in the cheeks. Do you tend to get red easily?
Yeah.
Oh, okay. Do you use a sunscreen?
I try.
Okay. Yeah. That's a good idea for your skin types. Definitely on the fairer side. Just going to take a sample here. Alright, you're just going to feel a gentle touch. I'm going to be palpating your face, okay? So you're just going to feel a light touch. Let me know if you feel any pain. I'm just feeling for any lumps or bumps, any edema or swelling. No swelling. I don't feel any buildup of edema in the sinus cavities. So that's good. Okay, go ahead and open and close your mouth. Okay, one more time. Good. No clicking or popping. Lymph nodes are non-palpable. And your preauricular and postauricular is also non-palpable. Okay, very good. Go ahead and try to lift your eyebrows. Alright, now lift them. Try to lower them. Good. Now try to turn towards your right with just your head. Good. Turn towards your left. Good. Now try to look up for me. Good. Now try to touch your chin to your chest. Excellent. Okay. Alright, go ahead and open your mouth for me. I'm just going to check. Your tonsils look healthy. Gums are pink and healthy in color. No dryness or signs of infection of the mouth. No signs of cavities or tooth decay. Okay. Don't think I need to take a sample there unless you're having any mouth pain.
No.
Okay. I'm going to do a simple pressure point test on your face and just your upper body, your chest and neck, just to judge for neurological function, okay?
Okay.
Alright, so this is going to be 1 pressure point. This will be 2. Do you feel the difference?
Yes.
Okay, good. Just a second. Okay. Alright, go ahead and say 1 or 2.
1, 2, 1, 2, 2, 1, 1, 2, 2, 2, 2, 1, 2, 2, 1, 2, 2,
Good. Continuing.
2, 1, 2, 2, 2, 1, 2, 2,
Good.
1, 2, 2, 1, 1, 2, 1, 1, 2.
Good job. Pretty pleased with that. Do you feel this puff of air on the right side of your face or the left side?
Right, left.
Good. Okay. Next, I'm going to do a smell test. So go ahead and inhale. Let me know what this smells like.
Orange.
Grapefruit, very close. So you passed that one. Okay, this one's more herbal scent, might be a little trickier.
Chamomile.
Yes, chamomile. Okay. Okay, go ahead and inhale.
Cedar.
Good. Sandalwood. It's very similar. And just a couple more. Go ahead and inhale.
Vanilla.
Good. And one more. This is very similar to that grapefruit.
Orange.
Good. Excellent. I'm going to go ahead and look at your ears. Any trouble hearing? No itching of the ears?
No.
Okay. Okay. Go ahead and turn your head to your right. Very good. Very healthy tympanic membrane. No excess wax. It's a nice pearl gray. No signs of infection or irritation. Go ahead and turn towards me. Very good. And same here. A little wax on the right side, but not enough to impede ear function. Just clean that out in the next couple weeks and you'll be good. Nice pearl gray. No signs of stress to the membrane. Very good. Do you hear my gloves on your left or your right side?
Left. Right. Both.
Very good. Okay. All right, you're going to feel a vibrational sensation and hear it throughout your skull and your resonance chambers. Let me know when the sound stops, okay? Just say no.
Now.
Good.
Now. Now. Now.
Great. Okay, we're going to do it again, just with a different tuning fork, and I'll also be placing it on your collarbone. Excellent. Okay. And with our last tuning fork, you're going to tell me which option sounds louder to you, closer to you. Option A or option B, okay? Okay. This is A. Here's B.
B.
Good. Here's A. Here's B.
A.
Okay. Here's A. Here's B.
B.
And did you hear that on your left side or your right side?
My left.
Very good. What about now? Left or right?
Right.
Good. Okay. So your hearing is great. Before I move on to your scalp, I'm just going to quickly check your eyes. Any problems with vision?
No, just when I'm trying to see something from very far away.
Okay. That can be an issue, but hopefully not too bad. Do you wear any prescription contacts or glasses?
No.
Okay. Go ahead and open your eyes for me. Just look straight ahead. Sorry about the bright light. Pupils look normal. Look to your left. Look to your right. Look up. Look down. Good. Okay. Same thing. Look to your left, right, up, down. Okay, and look straight ahead for me. No problems here. Normal constriction of the pupil, round and reactive to light. Okay, so I'm going to hold a sound chart right here. Can you read the third row for me?
F, P, H.
Good. What about the second to last row?
C, F, D, H, J.
Okay, what about that last row?
L, T, F, P, H.
Good. What's this color right here?
Green.
And this color?
Red.
What's this number right here?
4.
Okay, and is it larger or smaller than number 9?
Smaller.
Good. Okay. So, I'm very pleased with your cranial nerves. I'm just going to move on to look at your scalp and hair,
Okay.
and then we'll take a look at your elbow.
How's that?
Do you mind if I take off your
Not at all.
your hair tie?
Okay.
Okay. upon initial inspection, again seeing some of that redness that you talked about. I'm going to go ahead and just look with a light. It does look like it's been inflamed, and it's hard to tell if it's from primarily an infection or an allergic reaction. And I think it's been exacerbated by you scratching a lot. Do you scratch your scalp a lot?
Yes.
Okay. That's okay. Okay, I'm going to take a quick sample here. Okay. Just going to feel a slight tickling. Okay, I think that's a good sample. Just going to fill it with the saline solution. So our labs can detect if there's any irregular culture. Also, I'm going to apply just a few moisturizing agents to the scalp. So first will be a spray. It's going to feel cool. Okay. This is a different solution. It's rosemary infused with hyaluronic acid just to soothe the areas of irritation. Okay, this might be a little cold. Lastly, we just have a little bit of foaming lotion. That's really good for the hair. Okay, just combing that through so it seeps into the skin. It's going to help with the redness until we figure out exactly what's causing the irritation. I'm going to do a sharp or dull test, okay, just along the hairline. This will be a sharp sensation, and this will be dull. Can you tell the difference? Okay, good. Go ahead and say sharp or dull.
Dull. Sharp. 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 Dull. 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 Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp.
Good.
Sharp. Good. Dull.
Okay. Going to just continue. Going to just check the area right by the ear. Just to make sure that the infection hasn't affected the skin by the ear or anything like that. The skin over here looks a little healthier, so that's good. I'm still going to apply some treatment to it. I do see a few moles here. I'm just going to measure them just to have for our records, but just upon initial inspection, they do look normal. This one's about 1 millimeter symmetrical, and I can see that it's not raised. So that's good. Okay. One right behind here, right on the top. 2 millimeters by 2 millimeters, light brown in appearance, and I see it's not raised at all. Might even be a birthmark, but I'm just going to take note of it. Okay. I see one right here. Okay, that is a little larger, 0.5 centimeter by 4 millimeters, and slightly raised but symmetrical and dark brown in color, so not anything to be worried of. I do see one right here. That is a cherry angioma. Okay. It's very tiny, 1.5 millimeters by 1 millimeter, bright red in color, which is normal, nothing to be worried about. But just keeping records to track for any kind of growth. Okay. I'm going to go ahead and spray this area very lightly. Okay. Letting that seep in. Not the right solution. That was the saline. Here we go. Okay, some of the rosemary hydration. Really good for the scalp. Just applying it lightly to the part. Okay. Smoothing that in. Good. And just a little bit of the foaming solution. Was that painful at all? Oh, okay, good. Should feel very soothing. Okay. And here will be warm or cold. This is a cold sensation and this is warm. Do you feel the difference? Okay, go ahead and say warm or cold. Cold. Warm. Cold. 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 Warm. Cold. 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 Warm. Warm. Cold. 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 Warm. Warm. Cold. 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 Cold.
warm, warm, cold, cold, warm, 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 cold, cold, warm, warm, cold.
Okay, you can remain right there. I'm just gonna move and go ahead and check your elbow.
Okay.
So let me go ahead and see that elbow. Okay, I'm just going to take a look here. It does look a little cracked. Red, just with some irritation. I'll definitely take a sample. And I'm going to apply just kind of an exfoliating and moisturizing treatment to see if we can get some of the dead skin off.
Yeah.
Okay. Okay. Okay, so first I'm going to wet it a little bit. Okay, I'm just going to rub that in. There you go. Okay, it's gonna smell a little like green tea. Hopefully you don't mind that. And we'll wait on those results from the lab to see if there's anything to be worried about.
Okay.
I'm going to send you home with some of the scrub and also the rosemary hyaluronic acid serum.
Okay.
Just in the meantime, until we get proper diagnosis to help with the itching and the irritation, it's really going to soothe it.
Thank you.
Okay, so this concludes our exam today. Other than the skin issues that you mentioned, you're completely healthy.
Awesome.
And I'll be calling you back with those results, okay?
Okay.
All right.
Thank you.
Have a great rest of your day. Hi, Tori. How are you doing today?
I'm good. How are you?
I'm very good. So, tell me about the symptoms that you've been having.
So I haven't been able to smell for the past month, I would say.
Okay. Can't smell anything?
Mm-mm. I noticed it while eating.
Okay. So, do you smell anything that's not there? Like smoke or metallic? Just nothing at all?
No, just nothing.
Okay. Have you noticed a dry nose?
Maybe a little bit with the with the cold.
Sure, but this isn't something you've experienced before in the winter? Okay. What about temperature? If you drink something hot or eat something hot or cold, can you tell the difference there? Okay, good. I'm sure this has been affecting your appetite as well.
Definitely.
Okay. So, what about tasting?
Yeah, I haven't really been able to taste very much either.
Okay. No spicy foods, nothing. Okay. Any other symptoms that you've been having?
No, just that.
Okay.
Just the smell and the taste.
All right. I'm just going to go through just a few different symptoms and just say yes or no, just to make sure. Any dizziness on standing?
No.
No. Nausea? Heart palpitations or heart tremors?
Not that I've noticed.
No. Any family history of hyperthyroidism?
Yes.
Okay, on your mother or father's side?
Both.
Okay. Okay. Any family history of blood disorders or lung disorders?
No.
No. Okay. Have you noticed any fatigue as well?
Maybe a little bit.
Okay. Restlessness? Is it hard to sit still?
No.
No. Okay. And when was your last medical exam?
Probably a year ago.
Okay. So I'll be doing some of your vitals.
Okay.
Before that, I want to just get a sense of your smell. I know you said you're unable to smell anything, so I just want to go through several scents,
Okay.
just so I have on record that you're not able to smell them.
Okay.
Okay. All right. So go ahead, close your eyes and inhale. Okay, what did that smell like to you?
It was kind of hard to smell. Maybe like a flower.
Okay, that was lavender. Okay. Okay. What about this?
I can kind of smell it. It smells kind of minty.
Okay, that was rosemary.
Oh.
Okay. Okay. And this one should be pretty easy. Go ahead and inhale.
It smells like tea.
Okay, it's peppermint.
Oh.
So maybe that's partially right.
Mm-hmm.
Okay, go ahead and inhale. Does that smell like to you?
I can't smell that one.
Okay. That was sandalwood.
Mm.
Okay. Go ahead and inhale. What does that smell like to you?
I couldn't smell that one either.
Okay. That was lemongrass. Okay. What about this one?
I think it smells like lemon.
Okay, that was grapefruit. So close.
Mm-hmm.
Okay. Go ahead and inhale. What does that smell like to you?
I think it smells kind of like wood.
It's rose.
Oh.
So that was inaccurate.
Mm-hmm.
Okay. Okay. Go ahead and inhale.
It smells like vanilla.
Perfect. So you have one right. Okay. Go ahead and inhale.
I think it smells like a flower.
Chamomile. Floral, but definitely not accurate. Okay. Go ahead and inhale. And what does that smell like to you?
I couldn't smell that one.
Okay, that was violet. And not smell. Okay. Okay. All right, go ahead and inhale.
It kind of smells like cinnamon.
Perfect. Okay. Go ahead and inhale.
I can't really smell that one.
Okay, that was herbal rosemary. Okay. Go ahead and smell.
It kind of smells like grass.
It's catnip.
Mm.
Okay. Okay. Okay, go ahead and inhale. What is that?
I couldn't really smell that one.
That was nettle leaf. This one should be a little more straightforward. Go ahead and inhale.
It smells citrusy.
It's orange. You got that one right. Okay. Okay. Go ahead and inhale.
I'm not sure.
Okay. Let's frankincense.
Mm.
Inhale.
It smells like a flower.
St. John's wort. Okay. Go ahead and inhale.
I'm not sure what that one is.
Sage. And then one more. Go ahead and inhale.
It kind of smells like lemon.
Okay, that was bergamot, so not very good. So you're smelling about 10% of the scents. Definitely having some issues there. All right, I'm just going to do a quick color test.
Okay.
Go ahead and let me know what this color looks like to you.
Red.
Good. What does this color look like?
Orange.
This color?
Yellow.
This color?
Green.
This color?
Blue. Also kind of blue.
Okay, good.
Purple.
Perfect. Seem to have a good reception to color. Okay. Alright, go ahead and close your eyes. You're going to feel a puff of air in your face. Let me know if you feel it once, twice, or 3 times, okay? And you're going to hear a sound, but really focus on the feeling.
Once. 2. 3. 2. 2. 2. 2. 1. 1. 1.
Okay, very good. So I'm going to just sit you up on the bed and take some of your vitals and do a more in-depth sight and hearing exam, okay?
Okay, sounds
All
good.
right. Okay, I'm just going to put on some gloves and I'm listening. Okay. Okay, so just breathe normally for me. Okay, sounds like normal. I'm listen on the both side for murmurs. Okay. No mama's present, so that's good. Your heart sounds very healthy. I'm going to take your blood pressure. Will you lift up your... Perfect. And go ahead and cross your legs, relax. Okay. 108 over 72, so that's really good. Okay. Okay, I'm just going to palpate your face. I want to see if there's anything sticking out in terms of just edema or swelling. Let me know if you feel any pain when I touch. Okay, let me feel your sinus cavities. Normal. Your preauricular, postauricular lymph nodes. Normal to me. I'm going to feel your lymph nodes under your chin. Perfect. Okay. Go ahead and try to raise your eyebrows for me. I'm not going to let you do that. Good. Raise them all the way. Try to lower them. Okay. Try to turn your head to your left. Turn your head to your right. Good. Look up at the ceiling for me. Good. Touch your chin to your chest. Excellent. Okay, just all normal responses. Okay. Okay, I'm going to take a look in your eyes. Okay, your pupils are normal and reactive. No abnormal constrictions or dilations. No jaundice. No excess redness or signs of infection. Don't see any dryness either. Okay, go ahead and turn a little bit this way. Okay. Same thing here. Pupils round and reactive. Excellent. Alright. Okay. I'm sorry. Just trying to set these down. Okay. Go ahead and tell me which fingers are moving.
Okay.
The ones on your left or your right?
My left. Right. Both. Both.
Okay.
Left. Right. Bottom. Top.
Good. All right, now let me know when my fingers enter your field of vision.
Okay.
Say now.
Now. Now. Now.
Very good. Okay. See? Okay. Go ahead and keep your attention on the tip of this pen. Just follow it. Keep your head straight. Just follow it with your eyeballs. Perfect. Okay. Go ahead and hold this down chart at arm's length. Okay, can you read this row for me?
OLCF.
Yes. What about the second to last row?
EP. Oh, second to last.
Yes, I'm sorry, I pointed to the third. Go ahead, do the C.
C, F, D, H, J.
Good. And the last row.
L, T, F, P, H.
Good. Could you read it backwards?
H, P, F, T, L.
Excellent. What color is this?
Green.
What color is this?
Red.
Good. And is the circle number 9 larger or smaller than number 4?
It's larger.
Good. Is number 7 smaller or larger than number 8?
Smaller.
Okay. Going to be doing a taste test next, so I'm just going to give you a few different strips to taste.
Okay.
Okay, close your eyes. Open, close, open. What did that taste like to you?
Kind of bitter.
Bitter, very good. Okay. All right, go ahead, open, close, open. What did that taste like to you?
I didn't taste anything.
Okay, that was supposed to be sweet.
Mm.
So, and the last one. Go ahead, open, close, open. What'd that taste like?
I didn't taste that one either.
All right. That was salty. Okay. Okay, so next I'm going to be doing some hearing tests.
Okay.
All right, so first I want you to let me know which sound is perceived as closer to you.
Okay.
I'll give you 2 options, A or B. Okay. Does it say? Is this B?
B.
Good. Go ahead and close your eyes. Okay. A.
A.
Good. And it does the following sound seem like it's coming from above or below you?
Below. Above.
Good. Okay, to be doing a vibrational tuning work. So you're going to kind of feel a vibrational sensation as well as feel it. Let me know when the feeling and the sound stops.
Okay.
And of course, if it stops at different times, let me know that too.
They both stopped.
Okay.
They both stopped. They both stopped. It stopped. Stop. Stop.
You're going to hear a rustling sound. Let me know if you hear it in the left or the right ear.
Okay. Left. Right. Both. Left. Right. Both.
Good. Okay, I'm just going to take a look inside your ears. Okay, go ahead and look straight ahead for me. really hard to visualize because you have a lot of wax buildup. I don't think you have any signs of infection or improper ear health, but with your permission, I would like to do some cleaning today just so I can better see it. Okay, I'll look at the other side. Okay, same here. Although there's not as much wax, it's still very present. I can see the membrane a little bit better here, and it looks to be pretty healthy, but I just like to be sure. So what I'm going to have you do is just lay down on the bed, face up, and I'll clean your ears.
Awesome, thank you.
I'm going to start with just the alcoholic pads to sanitize the area. Oh, sorry. That's okay. Now just to test your ear sensitivity, I'm going to tug once, twice, or 3 times. Say 1, 2, or 3, okay?
Okay. 1, 2, 3.
Good.
2, 1, 1.
Good. Going to use antiseptic spray. You're just going to feel some cool and tingling sensation. Okay, and using a third swab, I'm going to just collect the sample. Just because I saw a little bit of redness that I think is just from the cold weather, but I want to make sure. But just turn your head a little bit this way, right there. It's perfect, just so I can see a little bit better. Using a little kit to scrape out the excess wax very gently. Let me see if I can better visualize. So go ahead and just tilt your hair very slightly. Good. Much more clean. I'm seeing a pearl gray membrane. Very healthy. No issues there. Okay, so I'm not worried about that. Okay, I'm just going to apply a little bit of oil and do some very gentle cupping beneath the area. And just move a little bit here. Okay. Okay, before I move on to the other ear, I'm going to do a little bit of pressure point therapy and then we'll do a pressure point test. Alright, let me know if this is too painful or too much pressure. Alright, let me know if you feel one or two pressure points. Just to give you a reference, this is 1, this is 2.
Okay.
Okay.
1, 2, 1, 2, 2, 2, 2, 2, 1, 2, 2, 2, 1, 1, 2, 2, 2, 1, 1.
Okay. Let's start with sterilization pad. And as I tug on your ear, say it once, twice, or 3 times. Okay.
1, 2, 3, 1, 1, 1, 2, 2, 1,
just apply some antibiotic ointment to prevent infection. Okay. Followed by sample collection. Still a specimen right here. And in beneath these folds. Beautiful. I'm going to give them some solution to live Next, I'm going to find the cleaning solution. Okay. Just going to get the excess debris out here. Okay. That's good. To do just some brush therapy. And we'll do one or two pressure points.
1, 2, 2, 2, 1, 1, 1, 1, 1, 1, 2, 2, 2, 1, 2, 2, 1, 1, 2, 2, 1, 1, 1.
Okay, Tori, so that concludes the exam.
Mm-hmm.
I'm going to do an order for a CT scan just to investigate more the loss of taste.
Okay.
Since it has been only 3 weeks, it could just be a hormonal change that your body's going through.
Okay.
But we do want to make sure that there's nothing serious.
Mm-hmm.
Your ears are very healthy, and that's what I have to say.
Awesome. Thank you so much.
Okay, thank you for allowing me to do this exam, and we'll see you here next time, okay?
Awesome. Thank you.
All right. Hi, Mata.
Hi.
How are you today?
I'm going okay. How are you?
Good, good. So I saw in your notes that you're here because of some vertigo issues.
Yes.
Could you talk to me about that?
So usually when I wake up, I feel really, really dizzy. And
Okay.
if I sit for like a longer period of time and when I get up to, walk around, I experience the same thing, the same kind of
Okay.
dizziness.
Okay. So dizziness, especially in the morning?
Yes.
Okay. Sorry to hear that. And how long has this been going on?
About a week.
Okay. Any other symptoms along with that? Any numbness or tingling?
A little bit of numbness and
Okay.
headaches too sometimes.
Okay, headaches. And what area of the body is numb?
It's usually like the back side as well as the right side sometimes too. But
Okay.
it starts from the back side.
Okay. Do you have difficulty determining temperature, like when you're in the shower, like how hot the water is?
I think it happened once or twice.
Okay. And do the headaches come and go, or do they happen at a certain time of day?
It's kind of like, it comes and goes. So,
Intermittent.
yeah.
Okay. And last time we did a head-to-toe exam, it's been about 1.5 years. You were in perfect condition. So I'd like to do something similar today. Of course, we're going to focus on your symptoms and really look at your head, do a very in-depth cranial nerve exam. But I'm also going to be just going head to toe, just so we can get on record that you're healthy in other areas, okay? All right. Any allergies to medications?
No.
Okay. Okay. And so I think I'm just going to start by doing just a couple vision tests right now. Then we'll have you get on the bed. Okay. So I'm just going to check your vitals right here. Okay. I'm going to listen to your heart and your lungs first. Okay. Okay, heartbeat sounds normal. Perfect. I'm going to listen on the bell side for murmurs. Excellent. Okay, take a deep breath in for me and release. Good. And again, deep breath in and release. Okay. I think your sleeves are thin enough that we can go ahead and use the blood pressure cuff without a problem. So, okay. All right, that's perfect. Okay. Okay, 108/80, so that's a really good sign. Okay, let's slide this off. Okay. Okay. 97.5, excellent. Okay, and we're going to get your oxygenation, so make sure your legs are uncrossed. Can I just have your index finger? Okay. Okay, your heart rate is 80 beats per minute, which is perfect. Oxygenation is 97 at room air. Okay, I'm going to go ahead and write down your vitals. Okay, really good. So I'm going to start just by palpating your face. I just want to feel for any lumps or bumps, anything that might stick out as being concussed or just swollen. So can I feel your lymph nodes? Preauricular lymph nodes are non-palpable, and so are your postauriculars. Okay, I'm going to feel your neck lymph nodes. Perfect. No swelling. No swelling of the face. I'm just going to feel right underneath your skull and your cervical spine for any indentations or protrusions. Okay. Okay, I'm going to be doing just some facial myotomes. I want to test your facial muscles' ability to react. So if you could lower your eyebrows like you're mad. Okay, now try to raise them for me. Good. Now raise them as high as you can. Now try to lower them for me. Very good. Next, I'm going to take my hand on the bridge of your nose, push against me. 3, 2, 1. Beautiful. Other side. 3, 2, 1. Good. Now we're going to do your whole face. 3, 2, 1. Good. And 3, 2, 1. Excellent. Okay. Now try to look up at the ceiling for me. Good. Now try to touch your chin to your chest. Okay, very good. Smile for me. Show me all your teeth. Okay, good frown. Okay. Any pain in doing that?
Just when I was trying to look up, I feel like a little bit of pain, but
Sure.
that was the only thing.
Where did the pain stem from?
I feel like it just started from like the chin.
Okay.
And it went kind of like upward, but for maybe like 2 seconds.
Sure. Okay. Okay. All right, I'm going to be doing some percussions, okay? So just tapping. Just make sure there's no swelling. Okay. All right. Just gonna be taking a look at your skin. Go ahead, close your eyes. Okay. Skin is well perfused. I don't see any jaundice, redness, no rosacea. Okay. Your skin looks like it has a perfect moisture level as well, which is a really good sign of overall health. Okay. Okay, I'm just going to measure the symmetricality of your face to make sure that we're good to go in terms of swelling and ruling out that as an issue. Okay. 6 inches here. And the other side is 6. Okay. That's 5 inches. Perfect. Okay. And then to the sides. 7.5. Sorry. That is 6.5. That's within the normal range. I'd say it's perfectly symmetric. Okay. Alright, I'm going to give you a few scents to smell. Just want to test your cranial nerves. And some of these are a little bit specific, so you don't have to get them all right. But as long as you're in the neighborhood of what the scent is. So this first one should be pretty calming. Go ahead and inhale.
I think eucalyptus.
Very close as lavender, but that's about the same. Okay. Okay, and this next one.
Kind of like vanilla.
Mm-hmm. It's sandalwood, so that one was a little bit long. Okay. And this next one.
Oranges?
Yes, orange. Okay. And next one.
Like sage?
Very close, rosemary. So that's very good. And this last one should be pretty easy.
Mint?
Yes, peppermint. So you got 4 of the 5 correct. I'm not too worried about that. Okay. Okay. Next we're going to do a taste test. So I have a couple slips of paper and they're going to smell like, taste like something. And these aren't going to be as specific as the smells. It's going to be like sour, bitter, or nothing. So go ahead and close your eyes. Open, close, open. What did that taste like to you?
It's nothing.
Good. That was the control paper. Okay, and the next one. Go ahead, open, close, open. What did that taste like?
Kind of sour.
Okay, yes, that was sour. So your smell and your taste are intact. I'm pretty happy with that. Next, I'm going to take a look at your eyes and your ears.
Okay.
Okay, go ahead and look straight ahead for me. Very good. Your pupils are round and reactive. No scarring, no yellowness, no abnormal constriction. Moisture level looks really good. I'm going to look at the other side. Okay. Same thing here. I'm not seeing any issues with the eyes. Very good focus. Normal constriction of the pupil. Normal coloring. No signs of infection. No abnormalities. Okay. All right. I want you to go ahead and grasp the Snellen chart and hold it at arm's length. Can you do that for me? Okay. Go ahead and read this bottom row for me if you can.
L T F P H.
Very good. And what about this row beginning with the E, ending with the O?
E P T Z O.
Good. And can you read that backwards?
O C T P E.
Excellent. Go Go ahead and read this row for me, starting with the O.
O, L, C, F.
Good. And then this row.
L, T,
And what's that big letter there?
E.
Good. What color is this?
Red,
What color is this?
green,
Good. And is the 8 larger or smaller than the 2?
larger,
Okay. Is the 6 larger or smaller than the 7?
smaller.
Good. Okay. Let me know when my fingers enter your field of vision.
Now,
Good.
now,
Good.
now,
Good.
now, now.
Very good. All right. And then which finger are closer to you? The fingers on your left or your right?
Right, right, left, right, both,
Okay.
left, right, left.
Okay. Little bit of inaccuracy there. You're going to go ahead and look at this stick of colors. What color is this right here?
Blue,
And here?
gray,
What about this one?
purple,
Hmm.
dark green,
Yes.
yellow,
Ish, yes.
like pink,
Okay.
then red.
Go ahead. Just a couple inconsistencies with blues and purples. Okay. So I'm going to do a hearing test next. Or looking at your ears. Okay, go ahead and look straight ahead. Okay. Your tympanic membrane is pearl gray. No excess wax, no signs of infection or scarring. Very good. No issues here. I'm gonna look at the other ear. Very healthy ear canal. Normal visualization of the tympanic membrane. I would clean your ears today, but you've done such a good job yourself of cleaning them. I don't see many issues here. Let me look at the outer auricle. No irritation. Very healthy. We're just going to do a few basic hearing tests. So close your eyes. You're going to feel my gloves rustling on either your right or your left ear. Say left or right, depending on which one you feel.
Left, right, both, left, right, right.
Very good. Okay. I'm going to do a couple exercises with tuning forks. Yeah, that's right. I'm going to give you two options, option A and option B. Let me know which sound is closer. Go ahead and close your eyes. A, B, B, good. A, B, B, good. A, or B, B, good. This is a vibrational tuning fork, and I'm going to be placing it in different areas of your face, and then I'll be stopping it. Let me know when the vibration stops for you, okay?
Now.
Okay. Okay. Very good. Okay. Just one more hearing test. Go ahead and close your eyes. I'm going to be whispering some things in your ear. Repeat exactly what you hear after me. Thanksgiving. Thanksgiving. Christmas. Christmas. Halloween. Halloween. Valentine's. Valentine's. Puppies. Puppies. Plant. Plant. Seashell. Seashell. Tissue. Tissue. All right, very good. So I'm pretty pleased with that. I'm going to have you lay down on the bed so I can look at your scalp a little bit more, okay? All right, Mata, I'm going to start just by brushing out your hair. All right. If you could lift your head gently. Thank you. Just going to be taking a look at the part. Doing a lice check. I'm going to take a look here. Just a little bit of flaking, and I'm just seeing some red patches. So I'm just wondering about that being the source of irritation, especially the tingling. Okay, so I'm going to take a few samples. Okay. Okay, so I'm just going to be taking some samples from the part. Okay, next we're going to find another area. Okay. Just going over the part that's flanking. Okay. Okay, that is 2. I'm actually going to put these here. Okay. I'll just run in this section. I'm going to move closer to the ear. Okay, not so much redness here, but you have a cherry angioma, a little bit of flaking. Just gonna make sure I get that. Perfect. Okay. And one more section. I'm going to do right in the center here. Okay. Just move it there. Not very much redness at the very top. So that's good. Perfect. And I'm just going to apply some saline solution to the sample bottles. Okay. Perfect. Okay. Okay. So now, okay. And the last one, just in the center of the scalp. Perfect. All right, excellent. So I'm going to put those aside. I'm going to add just a little bit of moisture to the areas of redness that I saw. This is hyaluronic acid, very friendly to the hair. Okay, just going to brush that through. Okay. We're going to do a warm or cold test. This will be a cold sensation. This will be warm. Do you feel the difference?
Yes.
Okay, go ahead and say cold or warm.
Cold. Warm. Warm. Cold. Cold. Warm. Warm.
Okay, just going to do it in the just going to do it in the midsection here.
Okay.
Okay. Go ahead and say warm or cold.
Warm. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Warm. Warm.
Very good. Okay, I'm pretty pleased with that. So I'm going to go ahead and move on to your abdomen. Sorry.
Okay.
All right, Matab. So with your permission, I'm just going to lift your shirt a little bit so I can listen to your stomach. Okay. Alright, sounds are normal. No excess acidity buildup. I don't hear any irritation that would be consistent with gastritis. Have you been having any digestion issues?
Some days I feel like,
Okay.
depending on if I'm hydrated or not, especially.
Sure. Is it like a burning sensation?
Oftentimes, yes.
Okay. Excuse my reach here. I'm just going to get these out of the way. So that could be some mild gastritis that you have, especially if it comes and goes. If it gets to be really bad, I always recommend going on a bland diet for a week to see if that changes it. Just rice, eggs, bread, just nothing too spicy or too greasy. I know that can be hard, especially this time of year, but if it gets to be too much of a problem, I can also prescribe some antacids to you as well if you're interested in that. Okay. Going to be doing some percussions. Okay, I think we're done with the percussions. I'm going to do a sharper dull test just to tell the numbness, level of numbness in your stomach. Okay, so this is a sharp sensation. This is dull. Okay. Let me know which one you feel. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Excellent. We're going to do a pressure point test here. So this is 1 pressure point. This is 2. Do you feel the difference?
Yes.
Okay, go ahead and say 1 or 2.
1. 1. 2. 2. 2. 2. 1. 1. 1. 2. 1. 2. 2. 1. 1. 2. 2. 1.
Excellent. If you don't mind, I'm going to be doing some palpations just to make sure that your organs are appropriately sized, that there's no hardness or enlargement. Okay, looks very healthy to me. I'm going to go ahead and check out your feet. Okay. Any issues with your feet? Itching, swelling?
A little bit of itching.
Okay.
I think maybe due to my eczema.
Okay. I'll go ahead and take a look then. Okay, so I'm going to go ahead and remove your socks. And just see what's going on here. I am noticing some patches here, a bit of dryness. I'm going to test your Rapinski response. Okay. Okay. I'm going to be taking this sensory brush and moving it on the right or the left foot. Go ahead and say left or right, depending on which one you feel.
Left. Right.
Both. Both.
Left. Left. Right.
Okay. All right. I'm going to just do some measurements to make sure that there's no swelling of the feet or different sizes. 28, that's perfect. 14 centimeters. That is 14 plus 14 minus 6. Okay. 12. 12. Okay, so the same size. Excuse me, I just want to make sure that your ankles aren't swollen. I'm just going to palpate just to see. Okay, so I don't feel any buildup of fluid, but I am noticing that dryness. I'm going to apply some of that same hyaluronic acid serum that I put on your hair. It's pretty much universal to use throughout the body. It's very, very good. Antimicrobial, and it has collagen.
Okay.
I think your feet will really benefit from it. It's going to be a little cool. Okay, so hopefully that will help. Okay, Mahtab, I'm going to go ahead and order a CT scan for you just to make sure that your vertigo issues aren't due to anything serious.
Okay.
The good news is I didn't really notice anything in particular that stuck out to me. A couple of inconsistencies in your sight and smell tests, and nothing that's too out of the range, but I just want to make sure. Okay, so you're going to go ahead and do that next week, and I'll give you a call to follow up, okay?
Okay.
Other than that, all your other vitals from head to toe were perfectly healthy. All right, so thanks for allowing me to do this exam and coming in today.
Thank you.
All right. Okay, Matthew. So, I'm going to be doing a ear inspection today. I'm going to be thoroughly examining the ear, applying some cleaning techniques, and if I see fit, therapy such as skin pulling or cupping. Okay, so you've been having some mild ear pain.
Yes.
Could you tell me a little bit more about that?
It goes towards the back of my ear, and
Back.
I feel like there's something inside,
Okay.
but I can't get it out.
Okay. All right, I'm going to take a look inside. Can I remove this earring?
Yes.
Okay. Okay. So I just want to visualize the tympanic membrane. It's a pearl gray, which is a good sign. We just need to rule out signs of an infection. I'm seeing a lot of debris, wax, and some clear discharge. So I don't see any pus, but it is clear and it has a viscosity to it that has me a little bit concerned. So I'm going to be doing an in-depth cleaning and looking again so I can better visualize what's going on. Okay. Okay, so first I'm just going to be palpating. Okay. I'm not feeling any contusions. Your lymph nodes are non-palpable, which is a good sign. So I don't think that this is a sinus infection. Do you have any pain here?
No.
Okay, so when I pull the ear up, do you have any pain?
No.
Okay, and down.
No.
Okay, and back.
No.
What about when I push forward?
No.
Okay. I'm going to be taking a sample of the outer ear just as it is now before I clean it. Okay. Okay. And we're going to start with an antiseptic spray. This is just to sanitize the skin. Okay. go ahead and just take your hair and move it a bit to the side. There we go. Okay. Okay. And this is going to help soften the skin because some of the cleanser is really harsh on the skin follicles, so we just want to prevent any kind of reaction. Okay. Okay, it's going to get a little cool. Just trying to visualize the internal structure in the area of the nape leading to the main ear canal. I'm seeing the corporal nerve is pronounced, which is not what we like to see, which just means that there is some inflammation going on. Okay. And so cleaning it does allow me to better see that this is an issue. I'm going to look behind here to see if there's any strain on the veins. They look purple, thin, which is normal. Normal outer aural nerves. Okay, just let me know if you feel any sharp pains. I'm going to be just tapping on certain parts. Okay. So the outer ear looks healthy with the nerve inside here. The corporal nerve is shutting out a little bit more than I'd like to see, and I'm interested to see if that is symmetric on both sides, if there's a characteristic to your ears, or if it is a problem. So now that I haven't cleaned, I'm going to take a closer look. Okay, we still have a little bit of wax. Okay. I'm just going to do some cleaning with a dry implement. Just getting out some of the excess wax. Okay. Okay, now that I'm seeing a little bit better here, I see some purpling, which I believe is just that blood circulation is compromised. I'm going to be using a tuning fork and just doing a couple hearing tests, okay? So I want you to answer which sound is farther away, A or B. This is A. This is B. B. Okay? Here's A. Here's B. A. Okay? Here's A. Here's B. A. Here's B. Okay. Here's A. Here's B. Okay. Here's A. Here's B. A. Here's A. Here's B. Here's A. Here's B. Okay. Here's A. Here's B. Good. Okay. I'm going to be placing it right underneath the ear. Go ahead and let me know when the sound stops for you. Okay. Okay. I'm going to be making a brushing sound right outside your ear. I want you to let me know when the sound stops. Just say no. Okay. And how many times do you hear the brushing sound? 1, 2, or 3? 1, 3. Okay. 2, 1, 3. Okay. I'm going to be whispering some colors in your ear. Repeat the color you hear after me, okay? Orange. Orange. Purple. Purple. Green. Green. Brown. Brown. Blue. Blue. Black. Black. Okay. So, I don't believe your hearing is compromised, but I do think that there are some trapped vesicles around the perimeter of the ear, and it's pointing to a loss of circulation. So I'm going to try to detoxify the area around the ear by just doing some pressure point therapy and also some massage work, okay, with some tools just to get the blood flow going, and then I'll go ahead and look at that vein again. Okay. Do you have any known allergies to topical ointments? Okay. There's a bit of swelling right outside the ear. No nodules or lumps that would indicate lymph node enhancement, but just some general swelling means that we just really need to work on getting the blood flow going. And sometimes hearing loud noise like fireworks or loud music at a concert can cause trauma to the ear and cause the veins to work extra hard. And the corporal vein has become enlarged. And it just needs to be worked on. So that's what we're doing here. Going to be tugging slightly on the ear. To encourage blood flow and getting rid of toxins that might be causing blockage. Okay, Magpie, so next I'm going to be applying some pressure point therapy to the outer edge of the ear and also along the lobe. If it gets to be a little too intense, please let me know. But this should really aid the process. And here I'm just wiping away some of the excess ointment. Okay. Okay, next I'll be adding some cupping therapy. just getting a hold of some of the trapped blood and moving it outwards to regenerate the circulation of the face. And I'm going in a circular motion. Very good. Okay. Okay, before switching to the other ear, I'd like to do a sharp or dull test, okay? So this is a sharp sensation, this is dull. Go ahead and say which one you feel. I'm just trying to test your neurological responses along the ear to make sure that there's nothing compromised, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, just a few incorrect responses there. I'm going to just have you flip around and I'm going to take a look at the other ear. Okay, I'm going to start just by putting your hair up to get it out of the way. Okay, that's perfect. Oops. I'm going to take out your earring. Okay. Looking inside, I'm seeing a little bit less inflammation here, but I need to clean it. I do see a couple of whiteheads. And wax buildup. Not as much purple, but I need to clean to make sure your tympanic membrane looks to be about the same color, which is a good sign. Okay. Okay. And taking a sample of the inner follicles. Okay. Okay, so it is being cleaned. I'm going to just tug on your ear. Let me know if you feel pain. Okay, and down. No, and up. And pulling inward. Any pain here? Okay. Okay. Post-auriculars are non-palpable. Sorry, pre-auriculars. Just a little bit of swelling along the midsection, and that's parallel to the corporal nerve. But I don't see as much swelling. Going to continue cleaning with the foaming cleanser. Right, this area has less inflammation. I'm not seeing as many purple spots. So there's definitely not infection, but it is, again, in need of just some work with circulating the blood flow. Okay. Okay, this nerve is not as inflamed. It barely is, so I think that the right ear is in a lot better shape, but I'm still going to do the same therapies. And just be sure to de-wax your ears on a regular basis. I'd say once every 2 weeks is a good time frame. And you might feel a little bit of soreness in both ears in the next couple days, but that's normal. There shouldn't be any shooting pain or muffled hearing. If you have any of that, definitely give me a call right away. But just general soreness means that the blood vessels are learning to reactivate. Okay. All right, I'm going to do a hearing test. You're going to hear the tuning fork. Let me know which is further away, A or B. A or B.
B,
A or B.
A,
A, B.
B,
A, B.
A,
A, B,
A,
A, B, A, B. Okay. Now let me know when the sound stops.
now.
Okay. Now let me know when the rustling stops, okay?
Now.
Okay. I'm going to whisper some holidays in your ear. Let me know the holiday that you hear. Christmas,
Christmas,
Easter,
Easter,
New Year's,
New Year's,
Hanukkah,
Hanukkah,
Valentine's Day,
Valentine's Day,
Halloween,
Halloween,
April Fool's Day.
April Fool's Day.
Okay, very good. And neurologically, you seem to be operating intact. I'm going to do a sharp or dull test next.
Sharp, dull, dull, sharp, sharp, dull, sharp, dull, sharp, sharp, dull, dull, sharp, sharp, dull, sharp, dull, 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 sharp, dull, dull.
So, neurologically, you seem to be intact. I'm going to have you lay down on the bed in a more comfortable position just so I can look at your scalp to make sure that there isn't any neurological problems in the cranium, okay? Okay, so just because I saw the purpling and the swelling in the left ear, I just want to go ahead and check the side of the scalp to make sure that it isn't a skin infection, that there's nothing to be worried about. Did you recently color your hair or dye it?
No.
Okay. Yeah, I'm seeing your hair looks remarkably healthy. Like there's no signs of previous dyeing or damage, coloring of the hair, so I can definitely tell this is your natural shade. Mm-hmm. Gonna take a closer look. The texture of the hair seems consistent. No excess moisture accumulation. Just spreading out the part more so I can see a couple moles here. But they look symmetric and healthy in shape. Okay, I'm just gonna see if there's anything like flakes or dandruff. So the hair looks to be clean. You don't have dandruff. I'm gonna just check with the lice comb to make sure there's no lice. Just looking at different sections. Okay, it looks to be clean. Just going to measure those 2 moles that I saw. Okay, that is half a centimeter here, and it is exactly symmetric, which is what we want to see. Okay, and we have between the 9.96. Okay, and then turning it around, then it's symmetric. That's good. We could just measure here. You don't see any swelling. I just feel your head for any lumps, bumps, edema, buildup of fluid, sinuses. So you can just relax, keep your eyes closed. Okay. And let me know if you feel pain or soreness. Just feeling on the cervical spine. Okay. Okay, hands look healthy. A little bit closer here with this parting tool. This is a retrograde cricopharyngeal light that we use to detect minuscule abrasions and abnormal skin patterns in the ear and scalp. So I'm looking for anything that lights up blue. I'm not seeing anything here. Okay. I'm going to just check right behind the ear with that. And nothing's lighting up blue here. Looks healthy. I just do a few different sections to check. And towards the top of the scalp, looking to see if the cricopharyngeal response is positive. I'm not seeing anything positive here, which means that your scalp generally is healthy. Just gonna make some taps here just to feel for edema. Just a very, very slight swelling, but not enough to diagnose edema or encephalitis of the cranium. Just a little bit of water retention going on here. Not a problem. Okay. Yeah, I'm going to apply some pressure point therapy to the scalp to help with that. But the signs of anything that would be a medical alarm definitely aren't there. Let me know if it feels too hard or too sore on top of that. This is just to encourage circulation to continue to flow within just the area beneath the upper layer of the dermis. Okay. going to use this tuning fork. Let me know when the sound stops, okay? Or when the feeling stops on your scalp. Okay, now. Now. Good.
No.
Okay. And the last thing we'll do before we end is testing sharp and dull along the scalp. I'm going to make an extra part for that. I'm doing right ear. This is the region that would be closely affected to the ear if there were any neurological problems. So just making best use of the region related to the main cricopharyngeal nerve. Okay. So go ahead and say sharp or dull.
Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Dull.
Okay, I'm happy. This concludes our exam for the day. I don't think that at this point it's necessary to do a scan because the problems that I noticed were superficial and I was able to lessen the irritation and the protrusion of the nerve with just basic massage techniques. I oxygenated the blood around the ear, applied cupping therapy, and hopefully you're feeling a little better. Your ears are going to feel slightly sore in the next few days. If you still are having that pain within a week, go ahead and give me a call and we'll schedule you for another appointment and perhaps get some imaging done. Okay? All right, go ahead and get up on your own time and I'll see you out front, okay? Bye. Hi, how are you?
you.
Very good. So I see you're a new patient with me today. Welcome to the clinic.
Thank you.
I'm Dr. K. First, let's just verify your first and last name and date of birth.
Yeah, my name is Relove,
Okay.
and then my birthday is August 13th,
Okay.
2001.
Okay, perfect. All right. And then tell me a little bit more about what brings you in today.
Yeah, I'm just having some issues, like a lot of head pain and like headaches, and my face has been kind of tingly, and then some of my parts of my body have been kind of numb. So
Numbness and tingling.
Yeah.
So just the face is tingling,
Yeah.
and the whole body is having spells of numbness.
Yeah.
Okay. How long has this been going on?
I'd say probably like 3 weeks.
Okay. And has the head pain been around the same time that started?
Yeah.
Okay. First, let's start with the headaches.
Mm-hmm.
Are they like a throbbing pain, or is it a very sharp pain? Is it dull? Go ahead and describe that for me.
I'd say it's kind of like a sharp pain for a little bit, and then like kind of a duller pain. Like, so like sharp pain for like a minute or two, and then dull
And then
for
it
about
dulls
30
out.
minutes.
Okay, it's probably more of a sharp pain then that's hits you so suddenly that it reverberates.
Mhm.
Okay, I'm just gonna make note of that. And then, what parts of the body would you say are numb?
No, I think it kind of like switches around. So
Okay.
sometimes my feet, sometimes my arms.
So it's the limbs of the body
Yeah.
that you're having those numbness on.
Yeah.
Is it like the fingers and toes, or the whole hand and feet?
It starts with fingers and toes, and then it's hands and feet.
Okay, alright. Okay, since this is my first time seeing you, I'm just going to ask you a few questions about your family history. So I'm going to name a few conditions and let me know if that's in any of your immediate family, mother, brother, sister, father, even grandparents. All right, so hypertension?
No.
No. Blood disorders?
No.
Lung disorders?
No.
Okay. Neurological problems?
Oh, my grandpa.
Okay. Okay. Any problems with vertigo in the family?
No.
Diabetes?
No.
Okay. Thyroid issues?
Yeah, my mom has some thyroid issues.
Okay, okay. Okay. Pelvic disorders?
No.
No. Okay. All right. So you said you're having some issues with the hands and feet. I'm going to take your vitals in a second, but for now, just want to see just the sand right now. Okay. Sorry, my hand's a little bit cold as I touch it. So right now, as I'm holding it, do you feel both of my hands holding your fingers? Okay. Go ahead and spread out your hands all the way. I want you to make them into a fist. Spread them out. Do that 5 times in a row as fast as you can. Okay. Was that the fastest you could go?
I probably could go faster.
Okay, go ahead and try that for me. That's okay. Good, okay. So I'm just going to gently press against each of your fingers, and I want you to press upward to resist my push, okay? We're going upward first. Good. Okay, good. Okay, that one was a little weaker. Good. Okay, so a little bit of atrophy there. Go ahead and put them to center. I want you to try to press down against my finger. Okay. Okay. Go ahead, let me see this one. Do the same thing with the fist and open. Okay. All right. Press up. Press up. Up. Okay. And press down. 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 And down. Okay. Go ahead and try to grasp my hand right here and try to pull against me. Pull the opposite way. Okay, good. Let's do the other hand. Okay, so definitely some weakness there in the phalanges. Definitely going to look into that. I'm going to start with your vitals right now, okay? Any dizziness on standing?
A little bit sometimes. It's just in the morning usually.
Okay. And go ahead and listen to your heart and your lungs. Okay. Sitting on the bell side for murmurs. Everything sounds good so far. Okay, no murmurs. Only S1 and S2 are present. Listen to your blood pressure. I'm going to use this arm. Okay. Okay. Make sure your legs are uncrossed. Okay, that's 120 over 80. I'm going to go and slide this off. Great. Any signs of fever?
No.
Feeling hot? 97.2, perfect. Okay, I'm going to go ahead and look at your index finger. Okay, just rest that there. Okay, your heart rate is 71 beats per minute. Oxygenation is 98% at room air. So next I'm just going to go ahead and do a face examination. I'm going to be percussing, palpating, and just doing some myotones. Okay. So I'm just going to start by palpating your face, okay? Okay. Just feeling your sinus cavities for any lumps or bumps, for edema, Go and lift your head gently. I'm just going to feel for any kind of concussion in the back. Okay, go and relax. Okay, gonna feel the cervical spine. Okay, no signs of scoliosis or abnormal curvatures. Okay, so I'm going to do some facial myotones. Go ahead and try to lift your eyebrows. Okay, lift your eyebrows. Good, now lift them all the way. Try to lower them. Very good. I want you to gently resist my push and turn your face to your left. 3, 2, 1. All right, other way. 3, 2, 1. Same thing. And to your right. Good, strong reflexes there. Go ahead and try to lift your head above you. Good. Now try to touch your chin to your chest. Okay, very good. Okay. Bring the pull gently on your ears. Let me know if you feel pain. No or yes?
No.
Good. And let me know if I'm pulling backward, upward, or down.
Backward.
Good.
Upward.
Good.
Down.
Beautiful. Just going to do some percussions to check for edema. Okay. Going to take some measurements of the face, okay? So just keep relaxing. I'm just going to check for symmetry. Make sure there's no neurological problems. 19. 19 on the other side. Okay. 21 centimeters. Center. Okay, we have 22. Let's measure with the other side. That's 8. Okay, that's 8.5 here. Okay, still in the round. Almost. Let's go ahead and measure your eyebrows. Okay, that's tight. There's here. Yes. 17. This side. 17. going to go ahead and grab a seat. We're going to do some sensory tests too, okay?
Okay.
All right. We're going to start with a wet or dry test on your face.
Okay.
So, one of these cotton rounds is going to be quite wet. The other one is going to be mighty dry. Okay. So, depending on which one you feel, go ahead and say wet or dry, okay?
Okay. Dry. Wet. Dry. Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry. Wet. Dry. Dry. Wet. Dry. Wet. Dry. Wet. Dry.
Okay. So definitely a lot of inconsistencies there. Some numbness in the face is definitely apparent. Just making note of that. Okay. Okay, the next test we're going to do is sharp or dull. Okay, so I'll do a sample test on your shoulder. This is a sharp sensation. This is dull. Go ahead and say which one you feel, okay?
Okay. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. So some inconsistencies there, definitely. Okay, so now we're gonna do the difference between, actually let's do paper or plastic. So when you feel this, you're gonna say crinkle. When you feel this, you'll say paper.
Okay.
Okay, it's a little bit more advanced here, but I have faith in you, okay?
Crinkle. Paper. crinkle, crinkle, paper,
Good.
crinkle,
Good.
crinkle, 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 paper, 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 crinkle, crinkle, paper, 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 crinkle, crinkle, paper.
Okay. Good. You got a lot of those right. So that's good. One more sensory test, and then we'll move on to the other tests. Okay. I'm going to do a pressure point test. So you're going to feel either 1 or 2 pressure points on your skin at the same time. If you feel 1, say 1. If you feel 2, say 2. Okay?
Okay.
All right.
1, 2, 1, 2, 2, 2, 2, 2, 1, 1, 2, 2, 2, 2,
Good.
1,
Good.
1, 2,
Good.
2,
Okay.
2, 1,
Good.
2,
Good.
2, 1, 1.
Okay. So some inconsistencies there. A little bit concerning. Okay. Just gonna go ahead and check the skin of your face. You can keep your eyes closed. Very well perfused. Don't see any purpling. Outward signs of nerve damage not present. Okay. We're going to begin the eye exam. So go ahead and open your eyes and follow this light. Just your eyeballs. Good. Okay. Now I want you to let me know when my fingers enter your field of vision. So when they do, say no. Go ahead and pick a point on that wall. Say that furnace thing. And let me know when my fingers enter your field of vision.
Now,
Okay.
now, now, now.
Okay. Now let me know when they leave your field of vision, okay?
Now,
Okay.
now, now.
Okay, very good. Go ahead and look at me. How many fingers am I holding up?
2,
Okay, try to look right at my nose. And let me know how many.
2, 1, 3, 3, 3, 1, 1, 1, 2, 2.
Very good. I saw you tried to cheat there. I'm going to look in your eyes now. Okay, so go ahead and look straight ahead. Sorry about the bright light. Very good. Pupils round, reactive.
No yellowing of the eyes. Look to your right, your left, up, down. Blink once. Okay. Do you have any dryness in your eyes or any eye problems?
Sometimes, yeah.
Okay.
My allergies act up.
I have a couple eye drops to recommend for you for that. One is Random Refresh, but I'll send you all the information. I'll write it down for you at the end of this.
Okay, thank you.
Because I have the same kind of problem. And,
Yeah.
Mm-hmm. Go and look straight ahead. Okay, good. Look to your left, right, up, down. Okay, blink once. All right, very good.
Okay.
All right, I'm going to hold this chart for you right here. Can you read that third row beginning with the F?
FPH.
Good. What about the row beneath it?
OLCF.
Good. The row beneath that one beginning with the S, ending with the D.
SBJHD.
Good. And beneath that, go ahead and read that normally.
EPTZO.
Okay, what about the row beneath it?
CFOHJ.
Good. And that last row?
LTFPH.
Good. And what's this color right here?
Green.
And right here?
Red.
And which circle is bigger, number 9 or number 6?
9.
Number 8 or number 4?
8.
Number 4 or number 2?
4.
Okay, good. So, no concerns there. Next, I'm going to take a look inside your ears, okay?
Okay.
Go ahead and turn your head this way. Turn your head, good. Okay. Some mild wax buildup. Otherwise, the ear canal looks healthy. Tympanic membrane is gray, invisible. No signs of redness, scarring, or irritation. How is your hearing, would you say, for the most part? Pretty good.
Yeah.
Okay, go ahead and turn your head this way towards me and I'll look. Alright, same here. Some definite wax. But the membrane looks very intact. Okay, no issues here. Just gonna look outside on the outer edges of the auricle. Looks good to me. Go ahead and turn facing front. Just looking here. Everything looks pretty clean here. Alright, great. Okay, go ahead and face upwards. Go ahead and let me know how many snips you hear. 1, 2, or 3.
1. 2. 3. 3. 1. 2.
Okay. Which snip sounds further away? Snip 1 or snip 2? Here's snip 1. Here's snip 2.
Snip 1.
Okay. Which snip sounds further away? Snip 1 or snip 2? Snip 1. Snip 2.
Snip 1.
Good. Okay. Okay, I'm going to place this tuning fork on your head. When you hear and feel the sound, well, you're going to hear and feel the sound, but when it stops, go ahead and say now, okay? Okay.
Now.
Good.
Now. 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 Now.
One more, just using a different tuning fork.
Now. 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 Now.
Good. All right, I'm going to whisper some things in your ear. Let me know what you hear. Repeat exactly what you hear after me. Christmas.
Christmas.
New Year.
New Year.
Valentine.
Valentine.
Shih Tzu.
Shih Tzu.
Puppy dog.
Puppy dog.
Snowman.
Snowman.
Good. Okay, I'm going to give you some things to smell.
Okay.
This is a very advanced smell test. Some of these are very specific essential oils. So I'm not expecting you to get them completely right, but go ahead and let me know if, do your very best. What's it smell like to you?
Lavender.
Okay, that's good. That was chamomile. Go ahead and inhale. What does that smell like to you?
Grapefruit.
With cinnamon. It's not good. Not good so far. Go ahead and inhale.
Eucalyptus.
That was lavender. So that was very close. Okay. Go ahead and inhale.
Is that orange?
It's bergamot. Go ahead and inhale. What does that smell like to you?
Peppermint.
Okay, that was rosemary. Go ahead and inhale.
I'm not sure.
That's okay. It's a rose. Okay, just a couple more and you'll be finished. Okay, go ahead and inhale.
Nutmeg.
Grapefruit. Okay, and last one. Go ahead and inhale.
Vanilla.
Very good. You got that last one perfectly right. The others not so much, so. Okay, we're gonna do a taste test. I'm just gonna put a strip of paper on your mouth. You're gonna taste it. I'm going to remove the strip. Let me know what it tastes like. So go ahead, open, close, taste, open. What does that taste like to you?
Green beans.
Green beans, that was correct. Green beans was right. This next one, go ahead and open, close, open. What does that taste like to you?
Mushrooms.
Yes, that was mushrooms. Perfect. Okay, so I'm not worried about that. Okay. Okay. So, I'm going to do a quick look at your scalp before we move on to your feet, okay?
Okay.
I'm just going to take a look here. Okay, hair looks pretty healthy so far. Okay, I don't see. I see a few dandruff flakes. No lice. No itching. No signs of red or flaking. Okay. Now, do you feel this when I tap here?
Mm-hmm.
Okay. Do you feel this here?
Yes.
Okay. We're going to do sharp or paper, okay?
Okay. Sharp. Paper. 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 Sharp. 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 Paper. Sharp. Paper. 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 Sharp. 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 Paper.
Good.
Sharp.
Good.
Paper. Sharp.
Good.
Paper.
Good.
Paper. Paper. Sharp.
Good.
Paper. Sharp. Paper. Sharp. Paper. Sharp. Paper.
Excellent. Okay. I take a sample of the scalp. Two. I did notice some dryness. I'm going to just apply some foaming solution just to that part. Just exfoliating that in. rest there. Next, I'm just going to go ahead and look at your legs and feet, okay?
Okay.
Okay, Rhiannon, I'm just going to be palpating your legs, okay? Just going to be feeling. Okay. All right, go ahead and here. All right, so we're going to do the same tuning fork thing with just your legs, okay?
Okay.
So let me know when the sensation stops.
Okay.
No.
Okay?
No. 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 No.
Okay. Do you mind if I just lift your jeans into your ankles? Okay. Okay. Just feeling for any edema in the feet. Thank you. Okay. I'm going to do a Babinski response test. I just want to see if your feet have a neurological response to my push. Okay. Okay. And let me know how many times you feel the squeeze on your toes. Once, twice, or 3 times.
Okay. Once. Twice. Once. 3 times.
Okay, Rhiannon. So, after your exam, you are having some issues neurologically that I suspect. I just want to take precaution. So I'm going to send you in for some scans where you're going to get an MRI, CT scan, and an X-ray just to make sure that you're doing okay. Your vitals are all great. So I think that this is probably just a minor issue, but it's something that we want to be on top of, okay?
Okay.
All right, so I'll get you all set up with that in the front. Thanks for coming in today and being a wonderful patient.
No problem. Thanks for your help.
Sure, bye. Hi, Matt P. How are you doing today?
I'm okay.
Okay. So I saw in your file that you're here for some issues with your scalp, and also you had some dimness in your smell and taste. Let me know what that's about.
It started about 3 weeks ago,
Okay.
and I just woke up from a nap.
Okay.
It started first with a smell. I was smelling some smoke, and
Okay.
at first I thought that something was on fire downstairs in the kitchen, but there was nothing on. And then for the whole evening, I kept on smelling smoke.
Okay.
And then I started having some weird metallic taste in my mouth.
Okay.
And then I just noticed that on the right side of the head, it's very kind of like numb.
Okay, so just on your right side.
Yeah.
Okay. Is this in your face? Does it go up to your scalp?
It goes up to the scalp a lot.
Okay. I'm sorry to hear that. So, are you having any tingly sensations as well, or is it just numb?
It's more numb
Okay.
than tingly.
Are you able to decipher between warm and cold? Like when you get in the shower, can you tell on that side of your face?
Now that you mention it, does seem a little bit like the water is room temperature
Okay. All right. And it's
versus it was used to be hotter.
Okay. Are you able to taste food normally, or is that completely
No, I
different
keep on
too?
having like this weird taste in my mouth.
Okay. Are you still smelling the smoke pretty much all the time?
Yeah.
Hi, guys, I want to share with you something exciting from one of my favorite jewelry brands, Ana Luisa Jewelry. They're having some incredible Black Friday deals right now. This is a company based in New York, and they are dedicated to creating really high quality, unique, elegant pieces of jewelry that won't break the bank. And so here are some of the pieces that I just got lately. This chain is absolutely gorgeous. I've gotten so many compliments on it. The way that it's textured so elegantly, I'm so obsessed. I've been wearing it all the time. And something I discovered is I can take these removable hoops from one of my other Ana Luisa jewelry pieces. Voila! And there's so many options. That's something I love about this brand, is so many of the pieces just complement each other naturally and are interchangeable, but they're just still so unique and gorgeous. So with this kind of necklace, I like a simpler set of earrings. I love these. These are subtle and beautiful. I can wear them every day. And I feel like I do lately. They've got some exclusive discounts only available during this Black Friday period. So if you're looking to grab some luxury jewelry for unbeatable prices and it makes the perfect gift, or if you just want to treat yourself, click on the link in my description box below. You're gonna be amazed. I do know that stock is running low, so shop now. Don't wait. These pieces are incredibly sustainable. They're waterproof. That's why they come with a 2-year warranty, which is insane. The shipping is fast and free within the US and super affordable elsewhere. This is the sale of the year for Ana Luisa. Like I said, it's the perfect gift. I'm actually waiting on some pieces in the mail for my sister that I'm going to surprise her with. So click on the link in the description box to elevate your jewelry this holiday season. Any pain or tingliness that radiates down your neck and shoulder?
Yeah.
Okay. And then for that neck and shoulder pain, on a scale of 1 to 10, how would you rate it?
It feels more like numbness, so not a lot of pain.
Okay, so just numbness. All right, and does that come and go, or is that pretty much constant?
It's pretty much constant.
Oh, okay. So I'm going to do a cranial nerve exam. I'm going to have you lay down on the bed, and I'm going to just do a very in-depth examination of your hair and scalp, the skin around the area, just to see if I can decipher any external factors in why you're having these symptoms, okay? All right. Okay, so this is going to be pretty in-depth. I want you to close your eyes, and I'm going to give you just a few scents to smell. We'll do a whole series and try to describe the smell to the best of your possibility. I'm not looking for perfection, but I just want to make sure that you have some semblance of accuracy. Okay, so go ahead and inhale.
Smells like onion.
Okay, that was red rose, so number 1 would be inaccurate. All right. This cycle one should be pretty easy. Inhale.
It smells like fresh grass, fresh dirt.
Okay, dirt. So that was peppermint. Oh, very close. And number 2, also inaccurate. Okay. And we have our third scent here. Go ahead and inhale.
Smells like rubber.
No, that was basil. So number 3, also discrepancy present. Okay. And the fourth one we have. Okay.
Doesn't smell like anything.
Okay, that was a pretty strong scent. That was lavender. So I'm going to write down that number 4 was also a miss. Definitely having some issues with your olfactory nerve. Okay. And this next one. All right. Inhale.
Smells like onion.
Okay, that was St. John's wort. Just taking that for an onion. Definitely not in the normal range. All right. I'm going to do a second row here. I just want to see if you get any of these right. All right, inhale.
It smells like paper.
Okay, that was violet. Okay. So the next scent should be pretty distinct. Go ahead and inhale.
It smells like garlic.
Okay. So that was sage. At least you got the fact that it was a herb right. But pretty distinct difference. Okay. All right, and inhale.
It smells like smoke.
Okay, so that was catnip. Okay. And this one, go ahead and inhale.
It smells like fish.
Okay, so that was the dandelion. So far none of these have been accurate, which definitely has me a little worried. Okay. This one is sealed pretty tightly, so the scent should be potent. Go ahead, inhale.
It smells like plastic.
All right, that was lemongrass. And one more. Very common one that's used in cooking. Go ahead and inhale.
It doesn't smell like anything.
That was rosemary. Okay, so definitely your sense of smell is completely compromised. Okay, going to test your taste. I have some testing strips, okay? Okay, so this one, go ahead, open your mouth, close, taste, and open. What did that taste like to you?
It tastes like onion.
So So that was control paper. It should have tasted neutral. Okay. And this is the second one that I want to use. So go ahead and same thing. Open, close, taste, and open. What did that taste like?
It tastes bitter.
Bitter. Okay. That was correct. It's good to know that. And one more. Open, close, open. What does that taste like?
Also bitter.
Okay, so that was sweet. All right. So both of these tests came back very concerning. Let's move on to just a general hearing test for you. So I'm going to be taking my gloves and making a rustling sensation. Let me know if you feel it on your left or your right ear, okay?
Left. Right. Right. Left. Both sides.
So that seems to be intact. Okay. Keep your eyes closed. I'm going to just be whispering a few different words and just repeat exactly what you hear after me. Pencil,
Pencil.
paper,
Paper.
light bulb,
Light bulb.
farm.
Farm.
Okay. Good distinction of pronunciations. I'm going to use a few different tuning forks. Okay, this first one, I'm going to give you two options. Option A or option B. I want you to tell me which sound is louder to you. Okay, so which one seems closer? A, B.
A.
Definitely not the case. All right. B.
B.
Okay. All right. A. B.
A.
Okay. So those should have been about the same. Next, I'm going to just use a different tuning fork. I'm going to be gently placing it on the sides of your face and also on the top of your head. You should feel a vibrating sensation. Let me know when that sensation stops for you, okay?
Stopped.
Good.
Stopped. Stopped.
Little delay there. Okay. One more.
Stopped.
Good. Okay, so for the most part, your hearing and that test was intact, but you're having an issue with volume perception. Okay. So I'm going to be testing your perception of color. I want you to go ahead and look at this wand here. We have an array of different colors. Do they look kind of different to you?
Yes.
Okay. What color would this be closest to in your mind?
It's a dark red.
Good. And here?
It's beige.
Good. And this one?
Yellow, orangey.
Mm-hmm. More yellow, yes. And this one right here?
Green.
Good. Is it dark green or light green?
Dark.
Good. And here?
Blue.
Good. And this one?
Gray.
And here?
Purple.
All right. And the top and bottom here, they're the same color. How would you describe them?
Clear.
Good. And then this right here in the middle of each stone, what would you say this color is?
Silver.
Very good. So I'm not too worried about that. Okay. All right. I'm going to hold the spelling chart right here. I want you to go ahead and read this row for me, starting with the A and ending with the O, or the E and ending with the O.
E-P-T-C-O.
Good. Did you have any difficulty reading that?
No.
Okay, and then this row right here.
C-F-D-H-J.
Good. Read that last row for me.
L-T-E-B-H.
Okay, so you got a couple of those wrong. When's the last time that you saw an optometrist?
About 5 years ago.
Okay, definitely time to go ahead and see that. To renew your prescription, do you wear contacts or glasses?
No.
Okay, you might be having some farsighted vision. I'm going to go ahead and ask you to read this top letter here.
E.
Good. These two letters here.
L-T.
Okay. So just some hard issues seeing this last row. I would say your vision is not perfectly a 20/20. It might be something to address just to prevent future damage. So, and then what is this color here?
Orange.
Okay, and this color here?
Green.
Good. Which circle appears larger to you? Number 2 or number 6?
6.
Number 6 or number 9?
9.
Okay. Number 8 or number 3?
8.
Very good. Okay. I'm going to go ahead and palpate your face. I just want to make sure that there's no lumps or bumps or excess swelling, okay? So you can close your eyes. Going to feel the lymph nodes. Pre-regulars and post are non-palpable. Lymph nodes to the throat are completely normal in size. A little bit of fluid builds up underneath the eyes, but that's normal. Okay. Going to do the back of your head as well. Any pain here?
No.
Okay, and still that numbness on the right side.
Yes.
Okay. So when I press against both sides, you feel it more on the left.
Yes.
Okay. Okay. I'm going to take this tool and just draw it from the very top of your face to the bottom. Let me know if you feel it all the way.
Yes.
Okay, from the nose to the ear. Let me know if you feel it all the way.
Yes.
And on the other side.
No.
Okay. Okay, just gonna use a different instrument. Let me know if you feel it all the way.
Yes.
Okay, let me know if you feel it all the way.
No.
You didn't feel it at all? Okay, so go ahead and write that down. Okay. Keep your eyes closed. Do you feel this puff of air or do you just hear it?
I just hear it.
Okay, how about now?
I feel it.
And you hear it? Okay.
I feel it. I just hear it. I feel it.
Okay.
I feel it. I feel it. I feel it. I just hear it.
Okay. So that tells me pretty much what I need to know for now. I'm going to go ahead and have you lay down in the bed, get comfortable, so I can take an in-depth look at your scalp, okay? Right. So if you're at a comfortable spot, I'm going to go ahead and just examine the hair. I'm going to make a part and inspect the area. Do some tests for the lab as well as some sensory tests. Right now I'm just brushing it out to make sure that I don't get anything tangled. Okay. I'm seeing a little bit of dandruff here. And just a little bit of redness, but not as much as I thought. Okay. I need to just use a couple clips to separate the part here.
Okay. Just testing the textural deviation. Definitely some flaking here. Trying to separate the strands to help me better visualize the scalp. Okay. I'm going to take a couple samples just to send to the lab, especially attaching on to these scaly patches here. I want to see so this is here now. Okay. Just really want to examine there. It's a little bit dry. I'm not seeing any dandruff here in the midsection of the strand. Just a lot of dryness. So I do have some treatment for that, but I'm going to start with just some water for moisture. Just to see if it helps. Just making sure it seeps into the strands.
going to set this aside. Okay. I'm seeing some indentations here that I'd like to just measure to have for the records. Okay. Definitely. Okay. Just a region here along the center of the scalp. That's 2.5 centimeters. Okay. Another area here. Another area here. That is just a cherry angioma. That's 2 millimeters symmetrically on all sides. Does not look to be irritated. Okay, just gonna be brushing through here. Okay. Just gonna use a different tape. Okay, let's see another little section here. Okay, that is about 3 millimeters symmetric, and I don't believe it's raised. No, it's not. Okay. There's a raised mole here, but it looks like it does not have ridges. This is 1 centimeter tall by 1 centimeter wide, so that is perfectly symmetric. Okay. And I see the strand. Okay, looks better. All right. Let's brush this out once more. So I'm going to be running a few sensory tests along your scalp, Pete. And first I'm just going to get a general assessment. Do you feel the sensory brush going from the center of your scalp to the sides? Do you feel it all the way? I'm going to start and stop. Did you feel that all the way? No. Okay. Was it completely numb?
Yes.
Okay. How about now?
No.
Okay, that was completely numb as well.
Yes.
All right. I'm just going some gaining of sensor perception at the top. What about now?
No.
Okay. And we'll do the other side. Okay, starting now. Ending.
I felt it.
Okay, starting now. Ending.
Yes.
Starting now. And ending.
Yes.
Okay. All right. So this test may be difficult to you, but do your very best. It's a sharp or dull test. So this is a sharp sensation, and then this one will be dull. Do you feel the difference?
Yes.
Okay, say sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp.
Okay.
Sharp. Dull.
Good.
Dull.
Okay.
Dull. Sharp.
Let me just get another section here. Okay, go ahead and say dull or sharp.
Sharp. Sharp.
Okay. And what about right now?
Dull.
Good.
Dull.
Okay. Alright. And right now?
Dull.
Okay.
Dull.
Alright, so a little bit of numbness here. Not too much of an issue. Now.
Dull. Sharp. Sharp. Sharp.
Going to just apply a little bit of moisturizing serum to help some of the irritation. It's gonna feel cool. Alright. I'm going to do a pressure point test. This will be 1 pressure point. This will be 2. Go ahead and say 1 or 2.
1, 2, 2, 1, 1, 1, 1, 2, 1. One, two, 2, 1, 1, 2.
Okay. Next, I'm going to percuss on the scalp. You're going to feel a light thumping sound. Let me know if you feel it once, twice, or 3 times.
Okay.
I'm going to just put on gloves first, just to make sure that we're sanitary. Alright. So again, tapping once, twice, or 3 times.
1, 2, 3, 1, 3, 2, 3, 2, 1, 1, 1, 2, 2, 2, 1, 1, 3.
Okay. So that's very good. No swelling detected as well. I'm going to just brush your hair to the side, and I do see just some red patches on your back. I'm going to apply a quick treatment. It's going to feel cold. Okay. Okay. All right, Mad Pete, that concludes our treatment for today. I am going to order a CT scan because the issues with your smell and taste were very off. However, your scalp sensitivity, and upon taking a further look, I'm not too concerned with that. So I'm going to give you an order. Go ahead and have it completed by the end of the week, and I'll give you a call and we can discuss the results and then how to go from here, okay?
Thank you.
All right. Thank you for allowing me to do this exam. Hi, Ginger. How are you?
I'm good. How are you?
I'm very good. So I did see you for a medical exam about 6 months ago, but you're here for another checkup. And I just want to ask first, can you verify your first and last name and date of birth?
First name is Ginger. Last name ASMR.
Sure.
Date of birth October 1st, 1995.
Excellent. Okay, and can you update me on any allergies that you have?
No current allergies.
None. Okay, and what brings you in today?
I've been having some like head pain a little bit.
Okay.
And then it's been a little sore when I walk for too long.
Okay, sore on the feet?
Mhm.
Okay.
Yeah.
Does the head pain and feet soreness, are they coinciding with one another?
Typically, yes. Like the more my feet hurt, the more I get like headaches and my head just starts to kind of pound a little
Okay.
bit.
Is it itchiness in the scalp or is it a generalized pain?
I would say a little bit of both.
Okay. Itchy and painful. Any throbbing sensations in the scalp or head?
Maybe towards the lower part, like the
Okay,
neck.
toward the
Yeah.
cervical spine. Okay. So on a scale of 1 to 10, let's start with the head. How would you rate that?
I would say probably a 7 out of 10 for
7
pain.
out of 10. Wow.
Mhm.
Okay. Are you taking anything over the counter?
Just typical Advil.
Just Advil. Okay. Well, would you describe this as a sort of headache that you've had before, or is it kind of new?
It's pretty new. That the
Okay.
intensity of the pain is new.
Sure. Okay. Do you have a history of head pain in your family? Migraines?
Yeah,
Okay.
yeah, definitely.
On both sides?
Yeah.
Okay. Okay. And with the feet, is it the pain on one foot or both feet?
It seems to be both feet. Pretty even amount of pain.
Okay, evenly. And it hurts most when you walk, you said?
Yeah.
Okay. Is it in the pads of the feet, the heels, or kind of all over, or is it hard to tell?
Kind of hard to tell.
Okay, so just generalized pain. Did you fall recently, or did you have a night where you exerted, or a morning day where you exerted yourself more than usual?
Yeah, maybe a couple weeks ago I was at the gym and I probably just didn't stretch properly. And
Okay. So just exerting the body sometimes can cause a strain too. Okay. So, any other ailments that you're concerned with, or is this the main?
Those are the main two.
Okay, great. Let me grab your vitals. Then we'll do a cranial nerve exam. I'm really going to pay an in-depth look at your scalp and also your feet.
Okay.
Okay?
Okay,
All
sounds
right.
good.
Just going to pop on some gloves first. gonna start just by taking a listen to your heart and your lungs. Any issues breathing lately?
Not that I've noticed.
Okay. Sounds are normal. No arrhythmia detected. And I'll flip it over and listen on the bell side. Okay, no numbers. I'm gonna listen to your lungs now. Just relax. Make sure your legs are uncrossed. And yes, they are. Okay. Okay, sounds are normal. Okay. Going to just listen to your blood pressure, okay? Okay. 120/74. That's normal. Okay, just gonna slide this off if I can. Alright. Can I grab your oxygenation if I could see your index finger? Okay. Okay, very good. Heart rate is 63 beats per minute. Oxygenation is 98% at room air. Okay. And I'm just going to grab your temperature too. Lovely. Okay. So next I'm going to have you lay down in the bed and we'll continue with the cranial nerve exam.
Okay, sounds good.
All right, Ginger, I'm going to start first by just visually examining the skin. Okay, so you can just turn your head this way. Just going to take a look. Just to rule out any signs of infections. I don't see any redness here. Skin is well perfused. No dryness or excess oil on the skin. Okay. I'm going going to be very gently palpating the face. You don't have to do anything, just relax. Just feel the top of the head, feeling for any lumps or bumps, signs of a concussion. Okay, I'm going to feel the thyroid. Feels normal. And the lymph nodes behind and in front of the ears, normal as well. Okay. Very good. Okay. I'm going to do some facial percussions, basically the same thing I did, just with a very tiny hammer. So continue relaxing. Everything feels normal so far. I'm going to take a look at your eyes first. Any problem seeing?
No.
Yeah, okay. We'll make this brief. Just want to make sure that there's no cranial nerve impacted. Okay. Let's go ahead and look straight ahead. Look to your left, to your right, up, down. Good. Okay, same. Left, right, up, down. Good. Okay. Okay. I want you to pick a point in the wall to focus on. Let me know when this light enters your field of vision, okay? Go ahead and say now. Now let me know when my fingers enter your field of vision. Go ahead, again, say now.
Now. Now. Now. Now. Now.
Okay, good. And which fingers are further away? The fingers on your left or your right?
On my left.
Okay. What about now?
On my right.
Good. And which fingers are moving? The ones on your left or right?
On my left.
Okay.
Right.
Perfect. Beautiful. Okay. I want you to hold the Snellen chart right in front of you, about at arm's length. Good. Can you go ahead and read this row here, beginning with the O, ending with the F?
O-L-C-F.
Good. What about this third to last row, beginning with the E?
E-P-T-C-L.
Good. And that last row, beginning with the L?
L-F-L-T-F-P-H.
close enough. What color is this?
Red.
What color is this?
Green.
Which circle is larger, number 8 or number 5?
8.
Which circle is larger, number 5 or number 3?
5.
Okay, very good. Any issues with hearing?
I don't think so.
Okay, we'll do a brief examination of your ears, but
Okay.
I won't linger on that as well. Alright, go ahead and turn your face this way. Perfect. Go ahead and look inside the ear canal. Okay. No signs of infection, no redness. Everything looks really healthy. I don't even need to clean the wax. It's a very healthy line of it here. Okay, go ahead and face me now. Go ahead and look at this. Okay, visualizing the membrane here. Nice, great, tympanic membrane. No issues here. Very healthy. The blood vessels are not enlarged. Okay, good. This is a tuning fork. Okay, I'm going to give you 2 options, A or B.
Okay.
Let me know which is louder, okay?
Okay.
Close your eyes.
Okay.
Here's A. Here's B.
A.
Good. Here's A. Here's B.
B.
Good. Here's A. Here's B.
B.
Good. Here's A. Here's B.
A.
Good. Excellent. I'm going to be placing a tuning fork on different resonance chambers of your head. Let me know when the sensation stops. Okay, say now. You're going to feel a vibration and hear it as well.
Now. Now.
Good.
Now. Now.
Good job. We'll do the same thing, just with a different tuning fork.
Now.
Okay.
Now. Now. Now.
Popsicle.
Popsicle.
Christmas.
Christmas.
Flowers.
Flowers.
Evergreen tree.
Evergreen tree.
Moisture.
Moisture.
Dryness.
Dryness.
Peppermint.
Peppermint.
Very good. Okay. Before we move on to the scalp, I'm going to give you a few things to smell and taste. Okay? Do your best with these. They're not all the easiest. Okay?
Peppermint.
Okay. That was cedar. So, a little bit of a difference there. Okay, go ahead and inhale.
It smells a bit strong, like nail polish remover a bit.
It's rosemary, but I can see why you think that. It's definitely a stronger scent. Okay. Okay, go ahead and inhale. What does that smell like to you?
Like flowers, floral scent.
Yes, that's jasmine. Very good. Okay. Go ahead and inhale. What about this smell?
It's a bit sweeter.
Mm-hmm.
Like a sweet scented.
It smells like geranium. Okay. So very good. Just 2 more and then you'll have passed. Okay. Okay, go ahead and inhale. What does that smell like?
Like something sweet, like licorice or candy.
It's vanilla, but yes, it is like a candy. Okay. And this one. Okay.
It smells citrusy, like oranges.
Good. Orange. Very, very good. Okay. Just looking along the part to see if I notice any irritation or redness. Just clip the hair back here, just so I can better visualize. Don't see any excess redness. I'm going to take a closer inspection with the light. I'm not seeing anything aside from a few indentations, angiomas. Okay. I just administer some serum. Scrape in. Stick it deep in the roots. So it's a cleansing and soothing serum.
just take a quick sample of the scalp. Okay. Great. We're going to do a sharper dull test in the face and scalp, okay? I want you to tell me which one you feel. Dull will feel like this little tickling. Sharp will feel like a cool sensation just like this, okay?
Okay.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull.
I'm going to be dragging this wooden stick along the skin. Okay?
Now. 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 Now.
Good. Going to do a quick test to gauge the strength of your hair, okay? Just gonna make a quick braid. I'm gently tugging on the hair just to gauge the strength.
strength of the hair. And just to see the fiber strength of the hair. Okay, very good. I'm just going to take a few quick measurements and writing of just areas of the hair that I might see an indentation. Round, symmetric, and flush with the skin, nothing to worry about here. Just want to look right above the ear. A little bump on the ear that I see. Just gonna measure that as well. Okay, that's not quite right. Okay. Alright, Ginger, I'm gonna go ahead and move on to your feet. Okay.
Okay.
Okay. Just going to take a look at the feet. Do have a little blister here. Looks to be healing nicely. Were you wearing a pair of shoes that were
The shoes that hurt my feet.
Just make sure to apply Neosporin from this point on and just give your feet a rest from those shoes. Just looking between the toes for any debris or
signs of fungus. I don't see anything here. I'm going to apply a cleansing foam and also a wipe. Okay. Just to clean the area. I'm seeing a little bit of redness. Just a little bit of swelling around the ankle. Not bad, just a little bit of treatment there. And serum. To hydrate the area. Okay. Feeling for any lumps or bumps. Got my callus here. So just some evidence of improper footwear, and that might be contributing to the discomfort. Continuing with the palpations. Okay. Deviation on your left or right foot?
Left.
Left or right?
Right. left, right.
Good. I'm going to do a pressure point test. This is 1 pressure point. This is 2. Say 1 or 2, okay?
2, 1, 2, 2, 2, 1, 1, 2, 2, 2, 2, 2, 1, 1, 1, 1, 2.
Okay. And same with the test on your face. You know when the vibration sensation stops, say now.
Now. Now. Now. Now. Now. Now.
Okay. We're going to check your pupils. We're going to end with sharp or dull on the feet.
Okay. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Good.
Sharp.
Good.
Dull. Dull. Sharp. Dull. Dull.
Okay. Okay, Ginger, that concludes our session for today.
Okay.
I did notice some redness in the feet. I'm going to just give it a rest, give those shoes a rest. And I'm going to send the samples that we collected from your scalp. And I'll be calling you in a few days to ask you how your symptoms are going in the next steps. I do have some serum that I applied today that I'm going to send you home with. But other than that, you're perfectly healthy.
Thank you.
Okay, great.